Great. Thanks. I'm David Jernigan. Rick gave you my current credentials. I've worked on alcohol policy issues for 35 years at every level, from local to state to national to global. I do a lot of work for the World Health Organization, and I'm delighted to share whatever I know and what's useful to you on the topic of alcohol taxes and public health.
Thanks, David. Thanks, Lane. So here's our agenda for today. We're going to run somewhere around 45 minutes on our presentation. We'll have some Q&A, and as Bobby said, feel free to put any questions in the Q&A box as we're going along, if that's useful for you to use. We're going to spend the first few minutes talking about and really laying the foundation of why an alcohol tax is important and kind of the science behind increasing alcohol taxes as a public health strategy for reducing alcohol-related harms. Then I'll give you a little bit of background about this study and kind of how it came to be, a little bit of history on our Hawaii Alcohol Policy Alliance that started a few years ago. Then I'll kick it back to David, who will talk a little bit about the Maryland tax study. We used the Maryland tax study that David was really involved in as a model for doing ours. And so he could talk a little bit about how that came to be and how that study was successful in helping the state pass an alcohol tax. And then we'll look at actually our tax study. We'll give you some highlights. Lane and I will talk a little bit about that. And then we'll talk a little about the next steps in terms of how do we take this tax study and then actually move policy forward at our state level. And I'll be looking to some of you here in our audience that I know to kind of help us with that. So, and then we'll wrap up with the Q&A. So at this time, I'd like to turn over to David. David, if you want to start us off here, let me see if I can. Sure. And I can move it forward for you.
Okay, that's great. Thanks, Rick. I don't know if you all are familiar with SAFER, but this is the mnemonic that the World Health Organization has put together to summarize the best buys and the good buys in alcohol problems prevention. The best buys being those that are most effective and cost effective, and those on this list are S, E, and R, and those that are good buys, also well supported in research. Those are the A and F. But we're going to focus on the R today, raising prices on alcohol through excise taxes and pricing policies. Rick. So the theoretical assumption here is that if you increase the economic cost of alcohol relative to alternative commodities, you will reduce demand. And the ways that this is generally accomplished is through increasing taxes, also through setting minimum prices for alcohol, putting bans on discounting, below cost sales, happy hours, and so on. And then also using taxes to disincentivize particular products that may be popular among lower income populations like young people. For instance, some states tax alcopops like Smirnoff Ice and Bacardi Silver more heavily, or even the new lovely alcoholic version of Mountain Dew. Next slide.
Heard about that.
Next slide. Yeah, great.
Sorry.
So when we talk about alcohol, mostly we're talking about alcohol not being an ordinary commodity, and that's the reason why it needs to be regulated so differently from other commodities. But when we come to the economics of alcohol, actual alcohol is much more ordinary than many people assume, in that the experience and the evidence is substantial that people increase their drinking when the prices go down, and they decrease their consumption when prices go up. And adolescents and problem drinkers are not an exception to this rule. So what you get when you raise the price of alcohol through taxes is reductions in alcohol-related problems. And this is a large literature. Unfortunately, over time, inflation has eroded much of the value of state and federal alcohol taxes, including in Hawaii. And the 2017 cuts in the federal alcohol tax, which were made permanent in 2020, have simply made this situation worse. Next slide. So this is just some of the published evidence. These are reviews. Alex Wagoner and his team looked at 112 studies containing more than 1,000 estimates of the effects on price on alcohol consumption and problems, and found that when the price goes up, consumption declines for the general population, as well as young people and heavy drinkers. And Alex and his team also looked at the consequences literature, and this is part of what led the Centers for Disease Control's Task Force on Community Preventive Services to conclude that increasing alcoholic beverage taxes and prices were related to reductions in alcohol-related problems. Next slide. And this is what has happened to both revenues and the actual amount of the tax. The tax amount is the blue line, the revenues is the 11 line. I'm sorry, it's the opposite. But anyway, you can see a big jump in 1991. That was the Bush 1 alcohol tax increase, and then steadily being eroded. If we move to the next slide, you can see that across the country, something very similar has happened with state level alcohol taxes. These are flat taxes. They are based on the volume of the beverage, and 12 ounces has not changed in the last 30 years, but the value of $1 has changed significantly. So if the taxes are not increased, every year that there is inflation, the real price of alcohol declines, and that's almost every year. Next slide. So the result is the price is wrong from a public health perspective. Off-premise, in grocery, convenience, liquor stores, etc., beer is often cheaper than water, orange juice, milk, and soda, and on-premise alcohol is widely discounted. I mentioned the 2017 tax cuts, and you'll hear more about what's happened to the tax, the real cost of the tax, and the cost of alcohol to Hawaii later on in the presentation. Next slide. So Mayor Bloomberg and the former Secretary of Transportation the Treasury, Larry Summers, co-chaired a global task force on fiscal policy for health in 2019, and concluded that if countries raise their excise taxes on tobacco, alcohol, and sugary beverages by 50%, we could prevent 50 million premature deaths over the next 50 years and raise more than $20 trillion in additional revenues. And raising the taxes and prices further would save additional lives and raise even more money. Next slide. The bottom line is that from a public health perspective, as well as from a state government perspective, alcohol taxes are a win-win-win. They raise revenues that can be devoted to healthcare access, prevention, and so on. They reduce alcohol consumption and problems. And over and over again, the polling shows they're popular with the public. So the challenge with alcohol taxes, of course, is they need to be raised sufficiently often that the actual affordability of alcohol doesn't increase. Next slide. Over to Lane, or Rick, or whoever. Rick, you're on mute.
Yeah, thanks, David. Thank you for that, David. Yeah, just so, just to segue into the background of how this came to be, and thank you, David, for kind of laying the foundation of why an alcohol tax is important from a public health perspective. So about 4 or so years ago, a few of us that were in the prevention field and working in community coalitions at the local level started to ask the questions about, well, what's kind of happening at the state level? And there was really no one that we knew of anyways that was looking at this, that was paying attention to any state level legislation. And so a few of us just started to get curious as the legislative session was coming around and look up subject lines like alcohol and see what kind of bills were out there. And to our surprise, probably not to David's surprise because he sees this throughout the country, there were a number of bills that were being introduced that were eroding, that were reducing the price of alcohol, particularly Alco Pops. David talked about Alco Pops being a dangerous product. There was a bill a few years ago that looked to reduce the price of Alco Pops and put it in a different category. to make it cheaper to produce, because the local breweries were saying that they wanted to use local ingredients, and so they needed to make it cheaper to compete with the Anheuser-Busch's and these sorts of things. And so again, to our surprise, there were a number of these bills that the alcohol industry was introducing, but there wasn't any public health bills that were pushing back, and there was no group of individuals that were kind of looking at these bills and pushing back on some of these alcohol industry bills. And so some of us started to get together and hooey up and say, well, what can we do about this? And thankfully, ADAD provided us some grant funding a couple of years ago. We applied for a grant to fund the statewide alliance, and we've been funded now for a couple of years on our current PFS grant. And this was a great boost to our capacity because it allowed us to hire staff. It gave us a budget to do some education and to really look at building our network of individuals across the state that could begin working on this. And so that's kind of the background of it. And then what we started to do the first year or two, we just kind of played defense. So we just went out there to look at what's the alcohol industry introducing this year, because they introduce a number of bills every year. And we just decided that we were going to try to keep those bills from passing because they were all eroding the regulatory structures of our state. But then in 2021 legislative session, we decided to try to introduce our own bill. And so we thought about kind of what would be a kind of best practice strategy, what would help, what would have the biggest impact in public health. And we came down to this idea of raising the alcohol tax. And our alcohol tax has not been raised in 23 years now, I believe. And so we went after that last year. We got we got it out of a couple of committees, and then we got our butts kicked by the alcohol industry. And then we kind of, started planning in the off session in the summer. And I connected with David and a number of other folks who had successfully done this in Maryland. And we just started saying, who's done this well, and meeting with folks and saying, okay, what do we need to do if we're going to pass a tax bill in our state? What kind of strategies, what kind of things do we need to be putting in place now to plan and prepare for that? What made you successful? And one of the things that made them successful was getting this alcohol tax study done locally. And that was really key and important, because as we were there in 2021 advocating for a tax increase, a lot of the legislators are saying, well, what about our state? I don't care nationally about what's happening. Tell us about our state. And so it became evident that we were going to need to provide some data that would show and model the impact of an alcohol tax for our state. Again, here, some of the lessons learned that I have below when we came out of last session was we were definitely going to need broader community support. We were going to need key organizations that could influence legislators. We were going to need to leverage the media more. But this number two piece was also critically important, and that is we needed data that was going to be specific to Hawaii. So David, do you want to talk briefly about kind of the Maryland as a model and how you folks were able to be successful there?
Sure. So as Rick said, these are challenging bills to pass. And we've done case studies of places where alcohol taxes have passed and have not passed. They don't frequently pass at the state level. So the situation we faced when we started the Maryland campaign in 2008 was our beer and wine tax hadn't been raised since Nixon was president, and our spirits tax hadn't been raised since Eisenhower was president. Alcohol was bringing in about $28 million to the state treasury. And so what we did was we led with a report where we pulled together all the available data on alcohol problems and alcohol consumption in the state of Maryland, as well as the available data on the cost of alcohol to the state, sort of basic harms data, and then some modeling of if we raise the price of alcohol, what could we expect would happen? We did that report in 2010 and kind of flushed out the arguments from the other side. We did a subsequent report in just in time for the 2011 legislative session that focused on two of the key arguments on the other side, that tax increases would cost jobs and that they would lead to cross-border sales. We also did polling and we polled no matter what you did with the money in Maryland, the majority of likely voters were for it. And if you gave it to the dedicated causes that our coalition were in favor of, then we got up around 2/3 of the likely voters supporting the tax. We worked with a large statewide coalition that extended substantially beyond the alcohol and drug and mental health field, partly because part of what we were going to do with the money was to increase access to healthcare for a subset of adults that were not currently covered in Maryland. We also joined with other groups like the developmental disabilities folks who were looking for more money out of the state budget. And then we generated a lot of news. We're good at generating news, and so we generated a lot of news using media advocacy to shape how the bill was framed. Mostly legislators think of these bills as ways to raise revenue. They don't think of them as public health message. And we just over and over and over again repeated alcohol tax increases save lives, alcohol taxes save lives, alcohol taxes save lives. Next slide. So the outcome was we got an increase in our sales tax of 3%. Sales taxes in public health, we like them even better than excise taxes because sales taxes do rise with inflation because they're a percent of the price. It's currently raising more than $100 million a year for the dedicated causes that our coalition had argued for. We already knew there'd be pushback attempts to repeal it when we got it passed. And so we were already planning the studies, and there have been 3 evaluations published so far. One of them found that it led to a substantial drop in gonorrhea cases. The second found that it led to a 3.8% drop in alcohol sales compared to what they would have been otherwise. And then finally, one study looked at the impact on alcohol positive drivers on Maryland roadways and found a 6% drop in the number of alcohol positive drivers that was attributable to the tax increase.
So I'll hop in now. Thanks, Dr. Jenigan. Like maybe mentioned, that Maryland study acted as the framework for the Hawaii study, which we estimate the potential effects of a 10-cent per drink increase in Hawaii. And so we really want to thank you, Dr. Jernigan, again for sharing your work with us and helping us get started on this study for our state. So I'd like to direct your attention to the image on the right-hand side. It looks like some of the text got small, but I'll talk you through it. So this is a basic visualization of what the model looks like. Some of the intermediary steps and calculations we omitted just from this visualization for the sake of simplicity. If you'd like more information, you can read the full paper, and I'll provide the link in the chat near the end of the presentation. So one of the first things that we needed to complete was to obtain various state data, including total revenue from liquor taxes, sales on liquor in dollars, and tax per gallon. And we obtained that from Hawaii State Department of Tax, as well as the State of Hawaii data book. And so we used the data and applied the 10-cent per drink increase to estimate the potential percentage increase in the price of alcohol. So we estimated that the price of wine, beer, and distilled spirits might increase between 6 and 13% due to the 10-cent per drink increase. Then we applied the price elasticity of alcohol to estimate the potential percentage decrease in alcohol consumption. So our team found numerous studies illustrating negative price elasticities. So in other words, as Dr. Jernigan was mentioning, that when price of alcohol increases, the demand for alcohol decreases. So we estimated that alcohol consumption would decrease by about 6.9% due to the increase. And lastly, we estimated how the increase in alcohol tax might affect certain harms related to behavioral health, physical violence, and alcohol-related deaths, as well as some aspects of government service utilization. To determine these potential effects, we again obtained numerous data from sources such as state and national reports, as well as some scientific studies. And we used it to calculate total cases in the state related to alcohol consumption. Then for each of these harms, we multiplied that number related to alcohol consumption by the 6.9% of estimated consumption decrease to find the potential decreases of those harms due to the 10-cent per drink increase in alcohol tax. Next slide. And so these are just some of the estimated annual effects from our modeling. And I believe I'll pass it over to you, Rick, to talk about that.
Sure. And Lane, as you can see on that slide before, and Lane, I don't know what happened to those words either, but Lane was really instrumental in doing a lot of data diving for us to come up with these numbers. And I just want to highlight that piece here that's on the top bullet here that you talked about in that previous slide, Lane, and that is a 6.9% decrease in adult consumption. That may not seem large at an initial look, thinking, oh, 7%, is that really a lot? But at the community level, that's a lot of reduction in alcohol. And that's going to lead to reduction in health consequences associated with alcohol use. And so that was a huge kind of eye opener, and that's a big win that we can get from a dime a drink increase with this bill. So some of the economic effects, and to David's point, a lot of legislators think only about the economic consequences of these types of bills. We estimated that we would raise just shy of $58 million to our budget, our annual budget. We would grow about 1,550 new government jobs, or about 434 healthcare worker jobs with that money. And then some of the health effects and impacts that we would get from a dime a drink would be 12,000 fewer adults binge drinking. We know binge drinking is the most dangerous type of drinking because it's associated with the most amount of harms. When folks are drinking quickly and getting intoxicated fast, that's when harms tend to occur. That's a huge number on just a dime a drink. About 4,500 fewer mental health disorder cases in the state. This is annually too. 1,900 fewer intimate partner violence cases, 550 fewer sexual assaults and rapes. So that's more than one a day. Government service utilization would also go down, we found. We'd have about 500 fewer ER visits across the state per year. We'd have about 350 fewer DUI arrests. We'd have, again, about 350 fewer crisis calls on the crisis hotline, and over 100 fewer law enforcement calls for service. Then we also looked at kind of who is going to pay for this tax, because taxes, alcohol taxes, are often seen as a regressive tax, meaning that the lower income brackets pay more while the upper income brackets pay less, essentially, for the tax. And we found that, generally speaking, this wasn't the case. So if you look here in figure 5, maybe a little bit hard for you to read here underneath, but on what we call non-excessive drinkers, meaning people that drink within the current guidelines, which is no more than 2 drinks per day for men and no more than 1 drink per day for women. We found that the highest income bracket of those making over $75,000 a year paid the most, and the lowest income bracket, those making under $25,000 a year, paid the least. So that was good, and it showed that it's not regressive for non-excessive drinkers. On the excessive drinking side, and that's defined as anything over a drink a day for women, over 2 drinks a day for men, or binge drinking in the last 30 days. And we found slight regressivity here in that the $25,000 to essentially $50,000 income bracket would pay about $32 more per year for alcohol. But the tax itself is significantly progressive, and that's really important to know, because the $58 million that we would generate tends to go to support people in lower income brackets, and so that money would be funneled for services and these types of things that are going to support folks in those income brackets, those lower income brackets. The figure 4 here on the right shows kind of what the cost for alcohol per adult would be with a 10-cent increase. So non-excessive drinkers are going to pay a little less than $5 a year, and excessive drinkers are going to pay about $26.70 per year for their alcohol. So we're really looking at a nominal fee for those, particularly that are non-excessive drinkers, and excessive drinkers are going to pay somewhere, again, less than $30. But to David's point, we really want to see excessive drinking be reduced with an alcohol tax, and so this will begin to price some people out from buying as much alcohol as they would usually buy.
Rick, if I could just make one
Yeah,
more
go ahead.
point
I was
on
going to
this.
to you, David.
Yeah, just one more point on this slide, which is these are the costs to drinkers. And it's also important to remember that about 47% of Hawaiians don't drink. That is, they did not have alcohol in the last 30 days, which is the most reliable recollection version of prevalence that we use. So again, this is just the drinkers. Nearly half the population will pay nothing for this tax.
Yeah, good point. Thank you, David. So what are some next steps, and how can we leverage this alcohol tax study to help push policy forward? You know, unfortunately, this year, we kind of got a little bit of a late start with it. We have since lost both of our tax bills on the House and Senate side for this year because the timing of the study was, we unfortunately didn't align it as well as we could have, and we didn't get the media and press as involved as we could have for this, but we're still going to be able to use this study to educate the public as we look into do this next year. As David said, these things rarely, if at all, ever pass on the first year that they're introduced. And so we know that this is going to be a little bit more of a long-term goal that we pass an alcohol tax. We're going to use it to as talking points and as an outreach tool. We've created a 2-page infographic on our study. I know the SEOW team, we being the Hawaii Alcohol Policy Alliance, has created a 2-page infographic. I'd be happy to share that in the chat box here when we're done. And I know the SEOW team has also created their own infographic on this to use as talking points. We're hoping to eventually do this public polling as well that David talked about. One of the keys to their success was showing that the voter base wants this, that they would support a tax increase. And so that's some of the next steps we hope to do. And we obviously need to boost our media, and we need to use the media and leverage the media to get our message out more. And hopefully post-bill passage, we can conduct a study similar to what Maryland did and look at what was the impact of a tax increase in our state. But we're going to need a lot of people for this. We're going to need broad community support. And so I see some of the names here in our attendee list. And if this is something that is remotely interesting to you, please feel free to reach out to me. We're going to need a lot of organizations to continue to build our capacity to pass this. And I'll probably be reaching out to some of you in the off session here to think about how we might increase our support for this. I think that's it. So do we have a question here in Q&A? Oh, okay. Did the alcohol tax die in this year's legislature? If so, what were the concerns by the legislators? Yes, so as I just mentioned, it did die on both the House and Senate side. They essentially deferred it, meaning they didn't vote on it. So they didn't vote it down. They just said they were not going to vote on it. And essentially, the concerns by the legislature, a few things. I think there's a lot of organization from the alcohol industry side of things to not pass bills such as this because it cuts into their dollar amount, their revenue. So I think we're up against a a highly organized group of the industry who push back on these things. I also think that this is a what do you call it? What's this year? They're gonna be I just spaced. They're gonna be reelected. It's an election year. So a lot of times in election years, legislators don't want to pass increased taxes because that can kind of have a negative effect on their ability to potentially be reelected. Those were some things that we heard. But I think generally it came down to that first comment of the alcohol industry is much stronger than we currently are right now. David, anything to add to that from your experience of working on these?
Just to say that in Maryland, it was a 2-year campaign. Similar to you all, we tried it first in an election year. And as you correctly said, legislators hate passing taxes in an election year. But then our coalition made it an election issue, which is something that coalitions sometimes do. The point that the lead organizer in Maryland likes to make is that policymakers, that elected officials are most interested in listening to us when they're running for election, and getting people at candidate forums, doing things like candidate resolutions, where you do ask candidates to take position on the tax, turns out to be a really helpful tactic. This cannot be done with government or 501c3 money, of course, because it is electoral organizing. But people have spare time, and they have done that very effectively. I would not be discouraged in California, in Hawaii. I think you're off to a great start. So we have another question in the chat, in the Q&A around the Maryland campaign. And in Maryland, we have a coalition on healthcare access issues that draws on about 1,200 organizations. It's very diverse. And there was a sense of urgency from the key elements in the coalition, including the developmental disabilities folks. One of the ways that these tax efforts sometimes work, quote unquote, is literally to kind of offer a chunk of the proceeds to key groups. And the developmental disabilities constituency in Maryland was not only well organized, but also had really compelling stories to tell about the need for services statewide. So they were very powerful in their testimony. We also had a lot of what I would call the usual suspects, but we also had a big labor union because some of the money was going to go for healthcare worker training. So legislators hate earmarking the money. They would just like to be able to dump it in the general fund and do whatever they want with it. And yet the public likes it if it is designated, and designating it, at least in the campaign going forward, can be a powerful way to build a broader coalition. My experience is these things don't pass just with the alcohol, drug, and mental health field. We're not big or powerful enough. But there are lots of constituencies that need government money, and this is a great way to raise it.
Well, I just have to say I'd be remiss without also saying thank you to Alcohol and Drug Abuse Division for funding this, for the SEOW team for taking this on so quickly this year, and for working on this. And so I just want to make sure that those two folks are recognized in this. And this is really important. If we're gonna actually look to pass something like this in our state, we're gonna have to put all these pieces together, and this was a critical piece. So I just want to thank our funders through ADAD, and as well as this SEOW team. So, and a special thanks to Dr. Fan and Lane, who really worked, and Bobby, who really worked closely on this.
And we've got some more time. I really encourage folks to put whatever questions you have in the chat or in the Q&A. This is something, as Rick said, this is going to take a lot of people and a lot of voices to get through. And I particularly would love for you to think about what are the hard questions that you worry that you might be asked, and how could we be helpful to you in helping you answer those questions.
While we're waiting for more questions, I just wanted to shoot a kind of deliberately vague question, which is just, how do you think COVID has impacted any of this, if at all?
That's a great question. Rick, maybe you can speak to it in Hawaii. I can certainly speak to what it looks like nationwide. Do you want to go first?
I'm sorry, was a private chat? Somebody, was it COVID?
How has COVID affected all of this?
Yeah, really, I'll put this. It hasn't been good from a public health perspective, because there's been a lot of deregulation around our structures that have been put in place to keep our public safe. Some of those that have occurred this year have been not needing licensee training. So anybody who's serving alcohol, this is at least in my county. So we have local control within our counties in terms of our liquor control departments, but like ours, and I believe some of the other counties as well, because of COVID, they weren't required to do the licensee testing. So, if I wanted to serve alcohol today, I could get hired at Maui Brewing Company today and start serving alcohol the same day without any type of training. These are just some examples. The delivery of alcohol, we still have delivery of alcohol that started during COVID. And so really, there's been a push to deregulate and make these deregulations permanent. I think that's what I would say about what I've seen happen in COVID. We also know we couldn't get these numbers. We were trying to get them for the study, but we also know drinking has gone up in our state, probably significantly. For example, I believe it was beer, if I'm not mistaken, and Bobby, you can correct me if I'm wrong, went down 1% in 2020. But if you think about the zero tourism we got from March to December, that 1% drop would actually significantly be an increase in our community, residents drinking that alcohol instead of our tourists. So those are just a few things. David, you want to say anything else to that?
Sure. We've been tracking whatever surveys are coming out nationwide. The consumption effects have been diverse because consumption is so related to how much money people have. And there have been periods where people have had a lot more money unexpectedly, and there have been periods where people have had a lot less money. There are definitely pockets of the population that have increased their consumption to levels that are of concern, and particularly women and BIPOC folks are showing up in studies as having increased their consumption. So that's sort of the consumption overview. You're hearing a lot about inflation. What inflation is doing is making alcohol cheaper. Because although the price of alcohol will rise, the tax amount will not. So overall, the impact is to make, again, alcohol cheaper relative to other products. One of the ways we can tell what's actually happening out there is by looking at both tax revenues and industry sales revenues. And what is clear, despite what you may hear out there on the hustings, is the pandemic has been good for the alcohol producers. It's been particularly good for the spirits producers, not so good for beer. Beer was down slightly, but spirits was up by about 5%, according to federal tax collections. So as one of my colleagues in the industry said to me, the distilled spirits people are doing a victory lap. Furthermore, most of this consumption is occurring off premise. And that's of concern. You're hearing a lot about, for instance, the homicide increase in cities across the country. Very few people are connecting the dots between that and increases in alcohol consumption, but off-premise consumption is substantially more likely to be related to interpersonal violence than on-premise consumption. And in the pandemic, we have a heck of a lot of off-premise consumption happening. The other thing you're likely to hear about in this debate is craft brewing and craft distilling, the quote unquote little guys of the industry. The industry likes to put this group forward as the face of the industry because it's small business, it's American creativity, entrepreneurs, and there are great sort of family-run business stories to be told. The Department of Treasury just came out with a study of competitiveness in the alcohol industry. One of the interesting things it said is that actually there was the tax cuts at the federal level were supposed to benefit the small producers, and most of the benefit went to the biggest producers. Also, Anheuser-Busch alone has in the last set of years bought up 10 of the most successful craft brewers. This is what's likely to happen with craft. This is an industry that benefits from economies of scale enormously, particularly when you get to distribution. And so there's just tremendous economic pressure to concentrate. There's another question in the Q&A. Is there a hypothesis as to whether why spirit use has gone up during COVID, but not beer? People are price maximizing is the most obvious, and spirits is the cheapest way to get, it's the strongest form of the beverage. And particularly if you buy it off premise and you buy it in large quantities, and that's another thing we saw happening a lot, particularly early in the pandemic, is people were buying, they were buying beer, they were buying 24 packs. If they were buying spirits, they were buying the largest sizes. If they were buying wine, they were buying boxed wine. People were price maximizing, and you get more drinks for your buck if you buy spirits in large quantities.
You're making an ever better case and argument for a tax increase there, David.
Yeah. Another question, were we able to increase the tax for all alcoholic beverage types? Yes, we were. What were the challenges we encountered? The same things you're encountering. And there are so many myths out there about alcohol, including that it's good for your health. And again, the cancer data has made that clearer and clearer. Alcohol is a carcinogen connected causally to 7 cancers. 15% of breast cancer cases in the US considered caused by alcohol. And a third of those happening at less than a drink and a half a day. So strategies the beverage companies will use. Rick, do you want to talk about that? And then I can talk more generally, or Lane?
Sure. Yeah, I think one of the strategies that they use that David just talked about was the craft brew being kind of the face of this. And so the slant that they would use is you're shutting down, these family breweries that are in your community, in the legislators' communities, and getting a lot of pressure for that from a small business perspective, that this was going to put them out of business or something to that degree. So I think that was a strategy that they used a lot. The other one that we have to figure out a strategy on how to combat it was that our alcohol taxes are not that low compared to the rest of the nation. I think we've got the 7th highest beer tax, and we're about middle of the road, right around 22 or 23 out of 50 states for spirits and wine. So they use that often against us to say, if we do a dive a drink, we're going to be the highest in the country, and that's going to put us out of business. So I think that was some of the tactics that were used.
Yeah, I think the other thing the industry does is they have a lot of contact with your state legislators, and they give a lot of money. You can track some of that. It's public data. It's important to track it. Again, one of my Maryland colleagues likes to say industry lobbyists are like cockroaches. They don't like sunlight. And so it's helpful to expose that to the extent possible. So I was thinking, I also wanted to mention, I mean, the other state that has passed alcohol taxes probably more than any other state in the last 20 years is Alaska. And they currently have the highest tax in the country. And they just passed another increase in the city of Anchorage. Really interesting campaign led primarily by people in recovery. But I think the point being that it's important to have a human face on these campaigns. The other point being that they work best when decision-making bodies need money. So the degree that the state of Hawaii needs revenue, this will fall on more welcome ears, particularly when we as public health make the case that alcohol isn't coming anywhere near to paying for the damage that it causes. These are great questions, and I'm really happy to be able to share with you some of what I know and my experience. I usually say I know more about this than anybody really should.
Well, it's a treat to have you here, David. Thank you so much for making time to be with us. Always enjoy listening to you and being challenged by what we need to do to be passing this in our state, and needing to call on many of you in the room to help us do that.
Well, I look forward to coming out to celebrate the passage.
Yeah, great. Yes. All right, Bobby, should we pass it back to you? Yep.
Yeah, I think that's the end of the Q&A section. And then, if you have any more questions that you think of, feel free to just message them during the meeting, or, shoot them an email if you have I think they have your contact info, right?
Yeah.
So,
yeah.
Yep. So, even
Great.
if, a few hours from now, you just like, oh, wait, I wanted to ask them this, but totally forgot, feel free to, ask them. So, sorry, let me find my screen again. So
I'll also put the tax study here in the chat box if
yeah, that'd be great.
we didn't do that yet.
Or yeah.
Good to be with you all. Thanks for the work you're doing in your great state.
Awesome. Thank you so much for joining us, Dr. Jernigan. All right, so with that, we'll have a quick 10-minute break. And then after that, we'll be discussing the SEOW charter. So see everyone at 10:08. All right. Welcome back, everyone. First, just want to say thank you once again to Rick, Lane, and Dr. Jernigan for that amazing presentation. And so as we transition to our second half of our quarterly meeting, first need to change my share screen. We will be going over our SEOW charter. Lane, can you confirm that the charter is being shown?
Yes, I see it.
Okay. Sorry, my Zoom screen's kind of weird. All right, so I see the charter. I'll just go over it really quickly, and then if you have any questions or feedback, just like for the previous presentation, please put them either in the chat box or in the Q&A box. So some of this should be a little bit similar to the introduction I gave. And so first of all, the purpose of the grant, the Hawaii SPF PFS, is to strengthen and enhance Hawaii's prevention system to promote well-being and reduce the impact of underage drinking among persons aged 9 to 20 in Hawaii's communities. And the mission is to promote the alignment and collaboration of prevention resources and priorities. And the goals of the Hawaii SPF PFS are based on the belief that the strength and success of a comprehensive prevention system exists at the community level. And the SPF PFS will increase the capacity of communities to effectively prevent and reduce underage drinking, substance misuse, and related issues at the local level, use the SPF to select and implement evidence-based programs, policies, and practices to best address prevention priorities for high-risk communities and populations, and align the prevention system's efforts to sustain community mobilization, collaboration, and the delivery of strategies to prevent and reduce underage drinking, substance use, and related problems in local communities. And the SPF PFS project staff, in collaboration with the lead evaluator, the lead epidemiologist, and the state epidemiologic outcomes workgroup SEOW lead analyst, will provide leadership to accomplish project goals and key activities during the award period. And the SPF PFS will build and strengthen collaboration among state agencies, stakeholders, and communities statewide concerning substance misuse and its associated consequences. So a lot of focus on local communities, which we know is very important. And so here we have a list of some specified impacted communities. So number one being Native Hawaiian youth. And so it's mentioned here that Yerbis data from 2017 shows that Native Hawaiian youth have a greater risk of alcohol use compared to other racial groups. And among the groups that where data was available, Native Hawaiian high school students consistently showed the highest prevalence in all alcohol use indicators, where 54.8% reported that they had ever used alcohol, 29.6% were current drinkers, as in drank in the past 30 days, and then 15.3% of boys and 18.7% of girls participated in binge drinking. And 21.4% of alcohol users had their first drink before 13 years of age. And the second community that's mentioned is LGBTQ youth. And so the underage drinking disproportionately affects gender and sexual minority youth. And so according to the Hawaii State Department of Health, Hawaii Sexual and Gender Minority Health Report from 2017, over 1 in 10 high school students self-identified as lesbian, gay, bisexual, and questioning LGBTQ. And using the Yerbis high school data, the report found that 45% of LGBTQ youth were current alcohol users compared to 25% for heterosexual youth. And moreover, LGBTQ youth were twice as likely to participate in binge drinking compared to heterosexual youth, so 20% versus 10%. And the third community listed in our charter is for homeless and runaway youth, where homelessness is another major public health problem within the state. And from the 2018 Street Youth Study released by the University of Hawaii, 151 homeless and runaway youth aged 12 to 24 were surveyed in the city and county of Honolulu, and found that street youth were 5 times more likely to report fair or poor overall health compared to the general population. And when looking specifically at youth drinking, 53% of youth in the study reported they used alcohol within 30 days prior to an interview. And for younger youth from ages 12 to 17, the prevalence was 44.4%. And so looking at the overall background for SEOW, most of this was mentioned in the intro to this meeting, so I won't repeat it, but it's here. And then here it mentions the SEOW approach. So utilizing the principles of evidence-based and outcome-based prevention, the SEOW provides input on the strategic use of data to inform and guide substance abuse prevention and behavioral health policy and program development in Hawaii. Through ongoing and integrated data analyses, the SEOW contributes to SAMHSA's strategic prevention framework, SPF, applied in Hawaii. And the 5-step SPF process is 1, assessment of population needs, resources, and readiness. 2, mobilization and capacity building to address needs. 3, prevention, planning, and funding decisions. 4, implementation of evidence-based prevention programs. And 5, evaluation of key outcomes and plan adjustments. And these 5 steps are informed and made relevant by sustainability and cultural competency considerations throughout the project. And looking at the objectives of SEOW in particular, 1 is to build capacity to assess and analyze data specifically on substance use and shared or common risk and protective factors that impact both substance use and abuse and related behavioral health issues. And 2, to continue assessment, monitoring, and surveillance using the SPF in order to institutionalize data-driven decision-making and prevention planning to address substance use and related behavioral health issues. And 3, to produce commentary, guidance, and research that helps to increase capacity on data collection, data analysis, data reporting, and data usage to address local needs and reduce substance abuse problems. And moving on to the next part about SEOW membership responsibilities, members are asked to attend quarterly meetings throughout the year like this one, provide data-related expertise when needed, so give feedback and advice for the substance use profiles, and training sessions for community stakeholders and need assessments, share substance use related data from the organization at the quarterly meeting or other occasions. So I know several of the people here have actually presented for these SEOW quarterly meetings, so thank you so much for that. And also introduce their colleagues or work connections who would be a good fit as an SEOW member. So if you know any other epidemiologists, data analysts, researchers, and individuals who have access to substance use data and would be interested in being part and attending these quarterly meetings, feel free to reach out and let them know and have them contact us. So the key SEOW activities, number 1 are data analysis. So identify risk factors, protective factors, and local conditions. Also collect and report annual state and county level data to determine progress towards addressing them. And also identify communities of high need, maybe even in addition to the ones that we mentioned and discussed early in the charter. And so identifying these high need communities, we could better fund them with SPF funds. And number 2, another key activity is thought leadership. So conduct rapid literature reviews, et cetera, to contribute knowledge on emerging issues. So I'll mention it later as well, but on our SEOW website, we have a number of literature reviews that have information on pertinent subjects, such as the impacts of COVID on behavioral health. And so if you haven't seen those or want to check them out, we'll provide a link to our webpage later as well. So number 3, about community and stakeholder engagement, which is in collaborating with agencies, organizations, and individuals to use data and skills in guiding and promoting positive behavioral health. And I think just this quarterly meeting is a wonderful example when you saw how we have all these amazing people working on this alcohol tax study, which came to create this really wonderful product. Number 4 is for technical assistance. So provide any kind of technical assistance and support to help subrecipients and state and local communities seek and use data and all these available resources to assist efforts to understand and address all these prevention needs in our community. And finally, for number 5, it's supporting development of a statewide strategy on prevention, as well as conduct surveys to collect data and additional information to better understand and describe the existing prevention system, where a lot of our work is involved in finding, collecting, and understanding data. And we need data and numbers in order to provide stronger arguments for why everything we're doing is important and how there are bigger issues, especially nowadays with COVID and everything else having such a large impact. Moving on to the next section in the charter about key deliverables. So number 1, we have our data products, so our epidemiologic profile using record level data or just data from all these surveys. We have the county epidemiologic profile. We have our infographics from our epi profiles, our presentations, our fact sheets, and our rapid literature reviews. For number 2 on data dissemination, we have our SEOW quarterly meetings, where we're bringing data gatekeepers and stakeholders together to share data and stimulate communication. And going back to our earlier presentation, I was really happy to see all these amazing questions we had for our speakers. And there's a lot of things that I just totally didn't think about that definitely brought a new perspective on things. Part B for data dissemination is task force participation. So participate in at least one task force, committee, or group that focuses on health disparities and or the needs and services of high-risk populations. Also, similar to what we're mentioning above about technical assistance, so have webinars on that, on how we can better use data to address substance abuse prevention needs, specifically in high needs communities and elsewhere. And then also mention, our webpage, which I've mentioned earlier, Twitter, LinkedIn, et cetera. And for 3, it's data-informed planning processes. So having a comprehensive strategic plan, having a criteria assessment tool for identifying high needs communities, also having a criteria assessment tool for other substances such as alcohol, marijuana, hallucinogens, also have an exploratory research study that collects more data on this, as well as have an SEOW evaluation and needs assessment survey. And ending with the impact of, what's the point of SPF, PFS, and SEOW, which in one sentence is promoting the well-being and reducing the impact of underage drinking, prescription drug abuse, and synthetic drug use, as well as strengthen and enhance the prevention system in the state of Hawaii. So that's our overall charter in a nutshell. Went through that a decent amount of time, and I think it's good in the sense that it highlights several very important things I think we all agree important, which is, focusing on the community level, especially for high need communities, as well as listing all of the specific deliverables and activities that we do. And so if there's any, feedback on that charter, feel free to send them in now. And if you think of anything later, feel free to email us at any time later too, if you have any thoughts and feedback. All right, so I think we can move on from the charter. So give me a second, I need to find the share screen. All right, so first, just wanted to give a quick list for the speakers we've invited for the next quarterly meetings we have for 2022. And so they're listed here. And so we have some really amazing speakers. So, hope everyone's excited for the next 3 that we have coming up. And our next quarterly meeting, I think was mentioned in the agenda, but our next meeting is scheduled to be on Wednesday, May 25th from 9 a.m. to 11 a.m. via Zoom. And so, be ready for that email when that gets sent out, and should be really exciting. And so with that, thank you everyone for attending today's SEOW quarterly meeting. And before I forget, I wanted to first ask everyone to please fill out this brief feedback survey to obtain your feedback on this meeting. Any thoughts? I'll put in the chat right now. Yep, so please fill that out. And then also, I think I mentioned our webpage a few times, which have our deliverables such as the rapid literature reviews. And you can check our webpage out at go.hawaii.edu/G/J. So that's the easy link to it. And then also, if you have any ideas for future speakers who'd be willing to share data related to substance use, or if you know anyone who you think would be interested in being a part of SEOW and joining all of our activities, then please let us know by sending us an email at piac+uhsow@hawaii.edu, and we'll be more than happy to reach out to anyone, whether it's a speaker or to someone who you think is really cool or would have anything or knows anything related to substance use. And so with that, that concludes our SEOW quarterly meeting for February 2022. And so please stay safe, everyone, and we'll see you in May.